wake up, take a pill, have your coffee, battle through the day, and then you repeat. Just consider for a moment breaking that cycle. Consider embarking on a journey towards a real cure, a real solution that repairs, not patches, that heals, not emboldens, the root cause behind how you feel, how you exist, the reason for your anxiety, depression, or stress, the cause of your pain. Many things can occupy the end game to that puzzle, but all solutions connect to nutrition in some way, from being the singular cause to the nudge that moves you towards improved health. And when I say the word health, I mean just that, not specifically mental health, as they are one of the same. Healthy body, healthy mind, after all, is not just a catchy saying. And to learn how to appreciate this, you need to understand the role nutrition plays in mental health issues and how it can help. Vitamin B6 can increase dopamine. Vitamin B3, with a little help from tryptophan, can increase serotonin. And vitamin K and D combined can aid GABA synthesis to keep you calm. These are cheap and readily available supplements that can help tremendously. The problem is, this isn't the conversation they want us to have. Welcome. I want to make something clear. Focusing on nutrition is not about abandoning your current regime, at least not immediately. This is also not an anti-drug conversation per se. It's about finding a cure, real balance, real harmony. And it's about how backwards mainstream treatment for depression really is. Proper support practices for mental health issues do exist. They're just hidden under the thumb of pharmaceutical companies and an ever-ignorant clinical arena. For example, many doctors are not trained in the science of nutrition. And if you really think about that, you'll probably start to realize the scale of the problem. The body needs good nutrition, fundamentally, to thrive and survive. It's needed to minimize the risk of disease, to heal wounds, to defeat viruses, to maintain athletic performance, or just to recover from a night out. Essentially, good nutrition helps maintain balance within the body. But somehow, in many countries around the world, doctors aren't taught about this important science. To me, that's like a doctor not knowing how to apply a cast or disinfect a wound. In society, there is this truly bizarre common sense disconnect that is masked, that is hidden by a state of blinding normality, a veil of ignorance put in place by big pharma, overstretched bureaucracies, and an ever-present progress-limiting stigma. We know nutrition is fundamentally what fuels the body and mind, but somehow, when it comes to mental health issues, we often ignore it. But let's take a minute to look at this from a different perspective in It's Time to Talk. When you take your motorcycle or car to the garage for repairs, the mechanics don't start swapping out parts randomly in the hope they accidentally fix the problem. They, of course, perform a thorough examination to determine exactly where the problem lies. And if the root cause can't immediately be determined, the mechanics will dig deeper until eventually the issue is found. They then explain what needs to be done, and then they do it. Voila, you have a healthy vehicle again. You went to see an expert, they did their job and helped. With medical experts, however, it's a very different story. If you take yourself to the doctor with a mental health complaint, they literally do just try random things. Try this serotonin reuptake inhibitor, or try this antipsychotic. If they don't work, we'll try you on something else. This isn't just a matter of unhelpful practices. Many of these drugs are actually quite harmful and very difficult to get off. And if doctors don't understand what's actually causing your problems, what's to say these drugs won't make things worse? And they often do. Did you know that 70% of the brain chemical serotonin is manufactured in the gut? This singular fact highlights the problem with what's called the isolated brain myth, where people consider the functions of the mind separate to that of the body. Most people don't realize, but a simple gut dysbiosis can cause drastic reductions in serotonin levels, which can make a person significantly more susceptible to depression. Why treat the symptom when you can treat the cause? If only doctors learned to take your cover off, open up your bonnet, and took the time to investigate your issues thoroughly. I see your magnesium levels are low, or your copper levels are a bit high. You wouldn't accept a mechanic who didn't know how an engine worked, or one that didn't bother to investigate issues. But somehow we readily accept this behavior from our doctors. Don't you think it's time we demanded more? I do. The truth is, unraveling the genetic dispositions that directly impact how our bodies respond to vitamins, minerals, and of course, poor lifestyle choices, admittedly can be a complicated game. The question you have to ask yourself is, do you want to address the source of your problems, or do you want to resign to taking a pill every morning just to maintain, at best, a dulled sense of normality? Antidepressants and associated medications have their place, emergency situations, and of course, more severe cases, but they should be the last line of defense and not the first. They can easily compound problems and often irreparably create more. They can also lead to unhelpful dependencies. Vitamins and minerals, on the other hand, only know how to nourish. It's also about lifestyle, having less coffee, getting more sleep, reducing sugar intake, minimizing alcohol consumption, having less of the things that drain your body of what it needs. The game is to spot the downward spiral and turn it around. Don't feed the black dog, but also don't accept a band-aid. Aim for a full, not partial recovery, because if you can discover the root cause of your issues, that's where you'll find hope. Nutrition is without a doubt depression's kryptonite. Balancing the body is the shield that protects, and discovering what's wrong is the sword that fights back. And believe it or not, even Tom Cruise agrees. Next time you visit your doctor, ask to see a nutritionist. Take control of your care. Don't let a physician untrained in the science of nutrition dictate how to fix your body. Nutrition and depression walk hand in hand. Find the root cause, find the cure. There's much more to come on this, but for now, just remember, you are not alone, and this is just nutrition and depression. Until next time.